Hello, my dear medical coders. This is Surya Johnson, your medical coding guide. In this series of ICD-10-CM guidelines, we've already completed to chapter 13, right? In today's video, we'll be learning about ICD-10-CM chapter specific coding guideline, chapter 14, which is the diseases of genitourinary system, series N00 to N99 series. If you're new to this channel, I am Surya Johnson. I am a medical coding professional. In this channel, I teach everything under the medical coding word. All about the medical coding guidelines, exams, how to crack the exam, tips, tricks, and how to appear for an interview. And all the questions that you ask in this medical coding field, I'm here to help you out. If you haven't subscribed yet, please subscribe and hit the notification bell icon so you'll not miss any of my future medical coding related videos. Hello everyone. In today's chapter 14, disease of genitourinary system, the series is from N00 to N99 series. So this series guideline is very small. This chapter 14 guideline is very small, only about the chronic kidney disease. So what is chronic kidney disease? First we have to learn about that. So the chronic kidney disease, also known as chronic kidney failure, it is the gradual loss of the normal kidney functions. That was the function of the kidney. The kidneys filter waste and excess fluids from the blood, which are then removed in the urine, right? So when these functions are disrupted, it results in chronic kidney disease, also known as chronic kidney failure, or in short known as CKD. So under this, the chronic kidney disease, so known as CKD, the first point is stages of chronic kidney disease, CKD. So the ICD-10-CM classifies CKD based on severity. So based on the severity, the ICD-10-CM has codes for the stages from 1 to stage 5 and end-stage renal disease, ESRD. So what is stage 1 is N18.1, which is the chronic kidney disease stage 1, and then we have the mild stage, also known as stage 2. Chronic kidney disease stage 2. So the moderate stage, the diagnosis is N18.3. And then we have the severe stage, which is N18.4, and then we have the chronic kidney disease stage 5, N18.5. Then there is the N18.6, which is the end-stage renal disease. It assigned this end-stage renal disease ESRD N18.6 when the doctor or when the provider, the doctor has documented in the documentation. So when the doctor documents chronic kidney disease CKD and ESRD end-stage renal disease, you will be assigning code N18.6 only. You will not be coding CKD separately and ESRD separately. No. This is ESRD is a CKD which is in this end stage. So the second point under this guideline is chronic kidney disease and kidney transplant status. Because some chronic kidney disease patient, what they do is undergo kidney transplant. They do a kidney transplant. Even after the kidney transplant, that patient might have some form of chronic kidney disease because the kidney transplant cannot fully restore the kidney function, right? It is a transplanted kidney. The patient has received a transplanted kidney, but you cannot assume as the patient has received a transplanted kidney, that doesn't mean the chronic kidney disease has been eradicated completely. There might be some functional difficulties, because the transplanted kidney cannot fully restore the kidney functions. So therefore, the presence of CKD alone does not constitute a transplant complication. If the patient who has received a transplanted kidney has some chronic kidney disease, it doesn't mean it is a complication. It is a transplant complication. You remember in the general guidelines we saw about these complications, right? So when there is a procedure has been performed and because of that procedure there is some complication, assume and code it as the complications because of this transplant or because of this procedure, right? But in this case, after a kidney transplant has been performed to the patient is still showing some minor symptoms of a CKD, chronic kidney disease, you should not assume and code it as a confirmed complication, transplant related complication diagnosis. So in this scenario, you will be coding N18 code for the patient's stage of CKD. At that level, the stage might have been changed because the patient has a kidney transplant. The stage will have been changed. So you will be coding the N18 series with the correct stage of CKD. And also you will be coding Z94.0, which is kidney transplant status. So in this scenario, you will not be coding a complication code. Got my point, right? It will be a normal CKD with the stage, patient stage of CKD, and then we'll be coding the Z94.0, which denotes the kidney transplant state. So if the transplant complications such as failure or rejection or other complications documented, then you will be coding the complication code of a kidney transplant from this chapter 19 series. I hope the second point is very clear. So third and the last point in this chronic kidney disease genitourinary system is chronic kidney disease with other conditions. Patients with CKD, chronic kidney disease, because kidneys regulates the waste products, right? Because of this problem in the function of the kidneys, this CKD, are chances for other conditions or complications to arise. Patients who are with CKD may also suffer from diabetes mellitus and hypertension, as these are linked. So in this scenario, when the patient is having a CKD, diabetes mellitus and hypertension, you should be following the coding guidelines. So when you choose the diagnosis code in the tabular list, there will be footnotes like which should be coded first, which should be coded as secondary. So follow those tabular list footnotes and code accordingly. That's what they're telling. So this is all about the chapter 14, diseases of the genitourinary system. Hope this video is clear. If you have any doubts, you can very well ask me in the comment sections below, or you can email me to this email address. If you found this video to be useful, please hit the like button and share with your friends. If you're new to this channel, please subscribe and hit the notification bell icon so you'll not miss any of my future medical coding related video. This is Surya Johnson, your medical coding guide.